We're here as well, as the supervisor noted and the senator noted, because we've seen a significant increase in the number of identified cases of COVID. I'll put it in perspective. That's rather simple to understand. This time last week, we were at 2.3% positivity. Today, we're at 3.3% positivity. They may not seem significant, but in percentage terms, that's a big increase in just 1 week. Last week, we had 5,400 cases identified. Today, just shy of 11,000 cases of COVID identified. So almost a doubling of cases in 1 week, and a positivity rate that increased substantially from 2.3 to 3.3%. So you can do the math on this and get a sense of the challenge that we all face here in the state, country, and around the rest of the world. We continue to believe in the absence of contrary data, though there is some conflicting data, that not only is the Omicron variant more transmissible, but it seems for those that have been vaccinated, and particularly those that have been boosted, to be substantially less severe than the Delta variant. But the caveat is for those that have been vaccinated, and in particular those that have been boosted. And so our goal is to continue to get people vaccinated. The most important shot remains that first shot, and then the most important shot for those that have received at least the J&J vaccine or 2 doses of the Pfizer or Moderna is to get boosted. It is increasingly clear, though it's not formalized, and we are not at this stage formalizing it in the state of California, that the full dosing is a 3rd dose. And that's why the booster is so important, and we're here to promote our boosting efforts here in the state of California. 8.7 million Californians have received at least a dose of a booster. We need to increase that number if we're going to hold the line and decrease the growth for hospitals and our ICUs. We're roughly about 3,600, just shy of 3,600 people hospitalized today. I'll remind you that January 6th of last year, or rather this year, we had just shy of 22,000 people hospitalized. 22,000, roughly 3,600 within a period of just a few weeks of where we're standing today compared to last year. So we're holding strong, mindful, though, of these growth rates and these trends. And so we can't take anything for granted. And we're here to promote not just boosters, promote new strategies, 3 specifically that we wanted to discuss briefly here today. Number 1, nothing more important when we're experiencing a surge in growth of case rates than protecting our frontline heroes and employees. And that's why we led as the first state in the nation to require all healthcare workers to be vaccinated. And we're really proud of those partnerships, our providers, remarkable support we received from organized labor as well as community clinics, not just our hospitals, that supported that effort. And that led to extraordinarily high vaccination rates for our healthcare workers, kept staff working, kept the morale strong, kept their immunity strong. But we recognize now that just being vaccinated, fully vaccinated, is not enough with this new variant, and we believe it's important to extend this requirement to getting that 3rd dose, to getting boosted. And so we are formalizing that. February 1st is the deadline to get that done. And I again want to just thank all our partners. We worked hard to get feedback and to organize this framework for their broad support in this space. I think it is a smart move. I think it's the wise move in this context that we need to make sure we don't have staffing shortages. We need to keep all of you healthy and safe. And again, the best way to do that is to get boosted. By the way, for those that wondered why we put out an executive order a few weeks ago, we did it in anticipation of this moment. We created some waivers, some flexibilities for our hospital system and our provider network, some decompression strategies, but we also allowed for contracted staff. We have 1,700 contracted staff in the state of California already to prepare for this increase. We have 500 more individuals that we have secured that are not yet into the state of California, and they're supporting 120 providers in the state. That was one of the purposes of extending that executive order. Again, all in an effort to prepare, not react, but to prepare for the moment we're in and the moments that present themselves in the very near future. We also believe that our most important agenda must be to continue our nation-leading efforts to keep our kids in school. And I just think it's an important point. Not only do we have 53% less deaths, and I appreciate, Senator, your reference to death rates than places like Florida, but Florida is not keeping their kids in schools because many of them are shutting down because of outbreaks like the state of California. I don't highlight that to pick on Florida, but there's a sort of meta message that utilizes the Florida example as the more appropriate example. But if you believe that deaths matter, you believe that pediatric hospitalizations are of concern, and you believe that shutting down schools is suboptimal, then you may want to look at the approach states like California have taken. And that's why I was very pleased that we put out a statement today from all of our school partners, from superintendents to teachers to those representing our janitors, our bus drivers, unanimously came out with a statement today affirming our commitment to keep our kids in person instruction and to keep our schools open. I do not want to see our schools shut down. And I'm very grateful that all of our partners in education put out a statement amplifying that message. So let there be no doubt that is our commitment, that is our priority, and in order to advance that priority, we are committing to the second point that I wanted to highlight of the three today, and that is after our kids have enjoyed the holidays with family, friends, safely, we hope, traveling in many cases, we want to make sure they come back in as good a shape as they left, meaning we want to make sure that we are testing our kids and preparing them to come back in-person instruction. And so we'll be sending out, we are ordering 6 million tests, no charge, and we're going to be sending those out to our partners all up and down the state to allow for priority access for at least 1 to 2 tests before our kids come back into school, so they have access to antigen tests and or PCR tests, but primarily antigen tests, so that they can get those results back quickly and make sure when they go back into person, they're doing so safely, knowing that they have not contracted the disease over the holidays. So that's the second announcement we're advancing here today. Number 3, we want to extend hours of operation for our nation-leading testing efforts. Let me be more specific. Based upon the federal government's own assessment, 20 or so thousand testing sites exist in the United States. We know for a fact California has 6,288, which puts us a little over 30% of all of America's testing sites are operational here in the state of California. That's why you're not seeing the long lines necessarily in around blocks like other cities and states, because we have access that's quite ubiquitous. In fact, we've been able to determine that 90% of Californians, and remember this is a state larger than 21 state populations combined, a lot of rural and remote parts of the state, 90% of California residents have access to a testing site that is within 30 minutes of their home, 60% within just 15 minutes of their home. We have 257 OptumServe partners, and we are working with them to extend the hours of operation, to expand them, particularly where there is high demand and there's some bottlenecks. And we're assessing that and working in real time. So we're also looking to expand the hours of operation to provide more access to testing in the state. I noted that we're going to be purchasing 6 million new tests for our kids. That builds on what we've done since August 21st, where the state has procured 12 million tests, providing them to community-based organizations like this, clinics large and small, hospitals, schools, and local health departments in this state. And that's just highlighting the fact, again, we're not reacting to, we've been leaning in on this testing frame. So, look, I recognize, as I've had family members that said, boy, I was just down at the Walgreens and CVS, they were out of the over-the-counter. I reminded them, if they go to My Turn, just Google My Turn, you will have a list that is proximate to your home availability for free testing. And you can learn about testing. It exists here, and testing exists throughout the state of California, if indeed the supply chains at the pharmacies and retail are a little bit behind, that you'll still avail yourself and have the opportunity to access that testing. I just want to remind people of that. And not many, not a lot of us can afford those tests at Walgreens or Safeway and the like. And so, again, My Turn has culturally competent information, many different languages. You can actually access not only locations, but you also can make an appointment on that platform as well. If you need more information, you go to the covid19.ca.gov website. That ca.gov confuses everybody. If you just Google My Turn, I think you'll at least have the access that provides at least baseline information that will help you on the way. So those are the three announcements here today. Get that third shot, get that full complement of vaccines for healthcare workers and nursing home staff to make sure that we are prepared to get our kids back in school. 0.3%, by the way, 0.3, that's 0.3% of the nation's school closures, even though we have 12% of the nation's student population. There's been 9,600 schools that have shut down in America, just 32 in the nation's most populous state, because we've led with health. We've led with vaccination efforts, and we're leading with masking, as the senator said, which is so critical as well as the most important non-pharmaceutical intervention we can advance besides common sense in terms of addressing this virus. So again, as I am often prone to be long-winded, forgive me, but this is important to share this information. And I'll just close, as I often do, reflecting back in the last year and a half. The one word is humility. We don't know what we don't know. Humility. Can't be ideological. Must be open to evidence, argument, and be willing to iterate in real time. And so I'm mindful at this moment, with the nation's lowest positivity rates, the 6th lowest case rates, that can change in a matter of days, not just weeks or months. And at the end of the day, nothing we do here at the state or even in Alameda County, which is doing an extraordinary job, matters compared to what you do and the decisions you make at home. And so I want to remind everybody of the power and potency of your day-to-day decisions in terms of our fate collectively and our future as it relates to this virus.